Hey guys, welcome back to Daniel Rosehill Plus here on YouTube. My name's Daniel Rosehill. This is a YouTube channel I set up to complement my main YouTube channel called Daniel Rosehill. This one's a little bit more freeform in terms of the topics that I talk about and whatnot, just really whatever kind of comes to my mind. And there's one that I wanted to record today, which I thought I had done before. I was just on YouTube now. I'm a big YouTube fan myself, as well as putting up some of these videos. And I was looking for gallbladder recovery, patient or years after my gallbladder surgery, or kind of search terms like that. And I actually couldn't really find any videos, which usually I do sometimes when I'm making YouTube playlists come across my own videos. So I was certain I had done that video, but apparently I haven't. So I said, for the benefit of other people going through gallbladder surgery or just looking, to kind of like get information about after people's recommendations for after gallbladder experiences, I thought I would upload my video. So just a quick disclaimer, as I do for anything I've uploaded on YouTube to date, which could be construed as medically oriented or whatever. This is not medical advice. This is just all basically my personal input or feelings about my own gallbladder surgery. So I'm going to try to cover pretty much everything in this one video, and I will rather leave timestamps at the bottom. So if you want to jump to a certain part of the video, go ahead and do that. And I'll just say at the outset that my experience from gallbladder surgery has been kind of mixed, in the sense that I didn't have a ton of symptoms. I have a strong feeling I didn't really need the surgery because they didn't find any gallstones when they, biopsied my gallbladder. And I've definitely had a couple of difficulties regarding sort of my health from the surgery. So if you're pre-surgery and you're looking to kind of stay motivated, just sort of a trigger warning. This might be a little bit more negative than some of the other videos up there on YouTube about this topic. So let me just start from the top as to why I had my gallbladder removed. So like most people, I had pain, but I think unlike most people I've read who've had their gallbladder removed, I kind of only ever had like really vague pains. I never had severe pain. I never had crippling pain. It never really was tied to eating. And that might sound like, well, why did you have your gallbladder removed then? So for me, there was this kind of pain I'd get occasionally in my right side, and my stomach's out of frame, but sort of here, kind of like right quadrant pain. And the only reason I went to my doctor, it didn't happen that regularly, but it was this pain that kept coming back to the same spot. For the first month, I was like, well, it's probably a pulled muscle or something, because that would explain it. But then I'm like, no, this has gone on for like 6 months, a year. So it was just like this vague pain that would come and go every few weeks. And it wasn't really a pain so much as like an ache or a discomfort, but it was definitely something. So there was one day where this pain was like really sort of like prominent, or more severe than it usually was, or this ache was stronger, longer lasting, whatever. So I said, okay, I'm going to get this checked out finally. So I went into a family doctor, and he was like, take a deep breath, and he prodded, and he was like, is that the pain? I'm like, yeah, you've got the pain. As it turns out that was my gallbladder. It's a medical sign called the Murphy sign. I've since learned, because I love researching all this stuff. So when he said it was your gallbladder, I was like, honestly, what the hell is a gallbladder? I don't think I'd ever heard of the thing before. But once I got that kind of positive sign at the doctor's exam, that sort of like set the whole process in motion. He was like, okay, we're going to send you for an ultrasound scan of your stomach, including your gallbladder. So I went, I had the ultrasound, and the first one didn't find anything abnormal. And I thought, great, well, he must have been wrong, or maybe something came and went. But this kind of went on for like another year. So we're talking about a couple of years that this kind of thing was like on off for me. But the pain, that weird achy feeling that felt like a muscle ache, but at this point I was like, I have a feeling he was right, it was a gallbladder problem. Same thing, came back to the doctor and sent me for another scan, and this time the scan said I had gallstones. So this was kind of bad timing, because I was getting married in a couple of months, and I was a little bit doing everything, moving apartment, preparing, planning my own wedding. We didn't, it was a very intense period of my life. So my family doctor advised me not to do the gallbladder, not to do surgery before the wedding, because she's like, it's just another stress you don't need. The X-ray found 2mm gallstones, and that was basically all the testing that I had, which I only realized in retrospect is kind of unusual. I feel like a lot of people in the US particularly have this kind of like more advanced testing and measuring your gallbladder ejection fraction. I didn't have any of that stuff. Basically what my doctor did was refer me to a surgeon. And I live in Israel, so the healthcare system here is probably not going to be the same as wherever you are based watching this, but referred me to a surgeon. And then the surgeon, it was like kind of the weirdest conversation ever. He was kind of just like, it was like a 3-minute meeting in total, I would say. Maybe 5, but let's say 3, whatever. Very, very short. And he was like, okay, we're going to take out your gallbladder and you can be back at work the next day. And I was like, all right, that just seems a little bit cavalier. Like, isn't the gallbladder, like, are we talking about like pulling out an organ here? So the kind of consult I had with the surgeon didn't really give me much encouragement to do the operation before my wedding. It definitely felt rushed and very, very kind of like lighthearted. He referred me to a surgeon at the hospital. That's just the way this works in Israel. Your health fund, in my case, my family doctor referred me to a surgeon in the health fund. And then the surgeon in the health fund referred me to the actually operating surgeon at a hospital. So I had a separate meeting. The meeting with the surgeon at the hospital was almost stranger, because he was kind of like, well, this might not be from your gallbladder, but it could be from your gallbladder, but we should take out your gallbladder anyway. And I just remember thinking at the time, like, that seems like kind of very flimsy logic. It's like, this kind of like pain you're describing, even though there's like whatever this X-ray results or ultrasound rather, it might be that, or this might be unrelated, but let's just like pull out the organ and see if it fixes it. So again, I was kind of like a bit skeptical. I'm obviously preparing for my wedding at this point, super busy, whatever. One day I get a call from the hospital and it's like, do you want to book your gallbladder surgery? And I told the hospital, this is one of my biggest regrets in life, I would say so far. I was like, can I think about it? Can I call you back in a day? They're like, no, you need to tell us now. Can I call you back in the afternoon? No, we need an answer right now. So I was basically pressured into having this surgery. I accept full responsibility. It was no one's decision but my own. But I don't feel like this is the way that this should happen for potentially life-altering surgery. Even if the medical profession is convinced that it's got no consequences and the gallbladder is not a necessary organ and you can be back at work the next day, which was absolute rubbish. There was no way I could have been working for at least probably a week after the surgery. I was like on painkillers and having a lot of pain. So anyway, I basically under pressure was like, okay, just book me in for the surgery. And I intentionally did something that I've never done before for medical stuff, and that was not go on to Google and research it. I did literally no research before the surgery. And again, I'm not blaming anyone but myself for this. But my tendency is probably to over-research stuff. And I was like, you know what? There's enough going on in my life right now between the wedding and the apartment that I'm not going to go down the Google rabbit hole. I'm just going to say yes and go in. So I go in after my wedding, like probably 2 weeks after my wedding, and I have the surgery basically. We're at the surgery now. So the surgery was sort of routine. I was kept overnight in a hospital. The care wasn't that good. Something weird about Israel where I live is that the healthcare is generally excellent, but the nursing is commonly really bad because they're just like, there's a shortage of nurses. So I remember like my wife who was with me had to like chase down nurses to give me like really basic painkillers, which wasn't very impressive. But whatever, I got discharged. The surgeon came in and he was like, yeah, it was a normal surgery and good luck. That's it. There was like no follow-up, there was no advice. There was no advice about. I didn't leave the hospital with anything other than a piece of paper for painkillers, like a prescription. There was no advice, no follow-up. It was just like, good luck to you. You'll be in pain for about a week, and then you can get your staples removed at your health clinic. So the first thing that kind of occurred to me that like there was some kind of repercussions from having the surgery was that I basically felt really, really nauseous. I had something called bile reflux gastritis, which is basically when the bile that your gallbladder usually contains comes up in your stomach. And I had that really bad for a couple of weeks after the operation. I was kind of like throwing up bile basically. Also, I mean, short-term effects of the operation are pretty much the same as far as I can tell, whether you have a successful surgery or you're one of those people like me who sort of have more complications in terms of you're going to be super bloated for a few days, and, you know, there might be other constipated from all the, you know, the anesthesia. That's kind of standard stuff. But for me, the kind of bile reflux went on for a little bit. The thing I would say is that trying to get proper aftercare for the problems that arose for me from my gallbladder surgery, that was where I sort of like stopped singing the praises of the healthcare system, if I even did, because it was like really bad. I was kind of very nauseous for a lot of days, and I just noticed some weird changes in my body. And I'm going to maybe sound a little bit crazy, but I know that other folks who've had gallbladder surgery have experienced similar symptoms, so I'm not the only person to talk about these. One thing I noticed was I would drink water and I would just get this weird like burp. That just didn't happen before. I live obviously in a very hot country, Israel. And during the summer, I, you know, would just buy like a liter of water and drink it in like one big go and like not think anything of it. And now it seemed to be that whenever I drank liquids, they sort of like just felt like they were sitting on my stomach. And I get this weird, I call it a micro burp after drinking water. And that was kind of like odd. I didn't think too much of it, but I was like, that's definitely something abnormal. It's like some kind of a reflex that's been reset in my body. So I really kind of ended up having two issues from the surgery. One of them was the bile reflux stuff, which is again kind of like gastritis. I felt really like my stomach was kind of raw for like weeks after the surgery. Felt very, very hungry, which is how I know now that when the gastritis is like back, is I'll feel super hungry. I can like eat a whole meal and like feel like I didn't eat. So I had that kind of raw feeling. I felt a bit like kind of nauseous. I also noticed that basically alcohol, I can't remember how long they told me to like not drink alcohol at all, whether it was 2 months or 3 months, I did it. But when I sort of like tried to reintroduce moderate alcohol to my diet, I would find that alcohol would be very nauseating, and I seem to like react very strongly to certain types of alcohol. The safest alcohol, and this is like, I'm now, by the way, coming up in 4 years since the surgery, 3.5 years. The safest alcohol seems to be like spirits for whatever reason. Something about the way my body processes beer has changed and now makes me incredibly bloated. Like not just regular beer bloated, but super bloated. Wine is a little bit better and spirits are better again. Perhaps it's due to the carbonation. Perhaps it's due to something else. I have no idea. I've done all the testing. Like my liver is fine. And it's just been all these like weird health problems that kind of kicked off after having my gallbladder removed. So my sort of final diagnosis have been two things. One of them is called functional dyspepsia. That's all the weird stuff with the burping. I can actually feel myself a burp kind of coming up now, and I've just been plagued by this bloating and burping. It's called for short FD, functional dyspepsia, and it's basically just a kind of catch-all word for all these upper gastrointestinal symptoms that before the surgery I did not experience any of these. It's like, well, if you go to like, you know, a Chinese buffet and you eat like 4 meals, you know, you pig out and you have like 4 servings, you're going to feel bloated and discomfort. And that's now kind of how I feel after even a moderately sized meal. It just, my stomach seems to want to bloat. And the other diagnosis I've got, which doesn't seem to be that helpful because there doesn't appear to be any real accessible treatment for it, and I had to see a gastro for this, is called abdominophrenic dyssynergia. Abdominophrenic dyssynergia. I'm going to say it again, it's such a confusing word. ADPD. And that basically means that there's some issue with the coordination between my diaphragm and my stomach. I usually will edit out whenever I burp when I'm doing a YouTube video, I will edit that out. So I'm going to just leave these in. So this kind of like low level burping has just been going on for me since the surgery, basically. The other problem I've dealt with is the gastritis. That phase of like it being really bad and throwing up bile, it seemed to kind of go away after a few weeks, but I still get it. The most frustrating thing is that I get it a lot after exercising. So I've been exercising a lot the last few weeks. I use a stationary exercise bike, And that I described it as very frustrating because something that I noticed is after the operation, I put on a bit of weight. I found it harder to maintain a healthy weight. And when these problems didn't go away and I saw a gastro, I got put on these drugs that make you gain weight, amitriptyline, nortriptyline. And then when I tried to lose that weight through exercising a lot, I found that would just make it felt like there was kind of no way to win. So I would say it's been an incredibly frustrating journey since my gallbladder surgery. I don't want to say I regret the surgery, just because I know for a lot of people are in a much, much more severe situation than I was in terms of getting really, really bad pain. And for them, the surgery isn't an option. If there's anything that can be learned from my experience, I would say it was as follows. When I got my pathology report after my gallbladder operation, they said that there was sludge. I'm translating obviously from Hebrew because the report was written in Hebrew. The weird thing is 2 months before the surgery, when I did my ultrasound scan, it said that there was stones in my gallbladder. So basically something really didn't add up, because generally when you pass stones, it's painful, and I didn't experience any pain, and it was just as if these kind of supposed stones just magically vanished. So something I really regret is that I just kind of let myself be rushed into the surgery by basically the system where I'm based moving at lightning speed. My doctor referred me to the surgeon. I saw the surgeon the next week. I saw the hospital surgeon the next week. He told me I could have it out and be back in a day. And honestly, I regret not asking the question to anyone, could we do the ultrasound one more time just to make sure there's really stones? Is there another option besides surgery? Can I get a second opinion? I think in sort of non-critical, and again, this is not medical advice, but I think, ask your doctor if it's not sort of a critical situation, you're getting severe pain, and like me, you're just getting this on-off pain. Ask them if there's any possibility that you could try something like, a low-fat diet. If you only have sludge, that might be able to avoid losing the organ, because I'm personally convinced that while it may be true that you can live without a gallbladder, I found it easier to live, much, much easier to live with a gallbladder. I've replaced an occasional pain with a daily kind of struggle with functional dyspepsia, gastritis. If I eat too much fatty food, sorry for the TMI, it's going to come straight through me as diarrhea. I probably spend more time on the toilet than I did by a magnitude, and it's just created a lot of problems. Not problems that are kind of unlivable with. And the one good thing that's come from my surgery is I got seriously depressed about 6 months after my gallbladder surgery, when I was not getting answers for all this, and I just felt like my body had run out of control. I developed really deep depression. I think I've had kind of mild depression for a long time, but it really kind of got to a point where I needed to see a psychiatrist and get medication. So the thing I'll always be thankful for my gallbladder surgery is that it finally got me in the door of a mental health practitioner, and now a few years later, it's been a whole journey in itself. It's also forced me to make a lot of healthy life decisions in terms of, really curtailing alcohol, because as I said, if I overdo it even slightly, it really, really hits me hard now. And something about the way it processes my body just feels like it's changed. Fat, and that's the final thing I'm going to talk about. Well, what's helped? The thing that's helped me more than anything else post-surgery, and this is what I just find weird, is that doctors don't tell you this. The dietary advice I got was, the gallbladder is not necessary. It's a redundant organ. You can eat exactly as you did before. You don't need to make any changes. And I can just say in my case, that was not the case. Reducing fat, and that was a whole process of learning about the fat content of food, that's helped me more than anything else that I've tried. And I've tried sort of tricyclic antidepressants, which made me gain a lot of weight, sexual dysfunction, whole shebang. And the good thing about a low-fat diet is, it's just, you can just do it yourself in a supermarket. It just involves a little bit of thinking. So that's helped me an awful lot. I've also cut out caffeine from my diet, because anything that increases reflux, I think, is going to make those reflux gastritis things worse. So it's forced me to do a lot of interventions that I think have been helpful and will be helpful for my long-term health. But of course, if I could have made these without losing an organ, it would have been a better thing. So that's my experience, coming up on my 4-year anniversary since the surgery. I would say I'm not 100% yet. And that alone probably indicates that I'm not a gallbladder success story. The fact that, you know, I exercised for 30 minutes a day and that's flared my gastritis back up tells me that I might need to keep going to a gastroenterologist or book another appointment to say, you know what, things are still problematic. But it's honestly, there comes a point where I just got fatigued from seeing gastros, from getting dismissed, from trying different drugs, from getting different labels, some of which were helpful, some of which just seemed to go nowhere. One other drug I've tried is cholecystectomy. That helped me a little bit. It's called a bile binder, and there's a couple of them on the market, and that kind of sucks up the bile. I'm going to actually ask about going back on that because I do think that helped a little bit, but I haven't found yet sort of a magic pill that sorted everything out. But the best thing I have found is, as I mentioned, really being strict about the no fat. And I just want to say, just my advice, anyone else who's had a tough post gallbladder experience and is looking at going no fat, or they're doing it and they're finding it helps, the one thing I can share or I've learned is that you have to be strict about it. That's been my experience. My wife said once, you know, is it like you can eat low fat for 9 days and then you can like have your fat day and like eat pizza? And I was like, I've tried that, but no, it does not appear to work like that. I have to literally be diligent about no fat every day. And if I had, there's no such thing as a cheat day, because a cheat day just means, excuse my vulgarity again, toilet diarrhea. So there kind of became a point in this struggle that I basically, you know, a lot of my favorite foods are fatty, probably why I ended up with gallbladder issues. But there just came a point where I was like, these foods don't appeal to me anymore, unless maybe like once a year. But like the pain that I know I'm going to go through, or the discomfort, or the whatever, it's just not worth it. So that's what I found is I need to personally keep to it 7 days a week. I'm going to wrap up the video. I just want to say that there are definitely a lot of people I've read since having the surgery who are dealing with the same issues I am in terms of bloating and discomfort and gastritis and bile reflux and the whole stuff. People shouldn't be dissuaded, but there are Facebook groups like Gallbladder Surgery Ruined My Life with like thousands of people in them, and there's a lot of people. I'm sure there's many more people who've had the surgery who don't go on the internet because they've no incentive to. But people who have had difficult outcomes, I think we need to advocate for ourselves. I think we need to sort of like figure out some way to share information together to figure out what might help, because I do think there is like a big gap between, this is my sort of personal opinion at this point, between what the medical profession says gallbladder surgery is a nothing operation, it's keyhole surgery, it's no effect, whatever, and the experience of hundreds of thousands of patients around the world who their bodies question the wisdom of that. And to me, it does not feel like a nothing surgery. It feels like it's really fundamentally changed my digestion, metabolism, not in positive ways, but I am a man of faith. I'm religious, and the comfort or solace that I try to take is that I believe ultimately it will have been for the better for me in terms of forcing me to live a healthier long-term lifestyle. And I think I'll get to the bottom of it, but it hasn't been an easy journey so far. So there you go. I think that's enough detail. I'll leave it at that. And of course, for other people who are sort of like dealing with similar stuff, have advice or whatever, do feel free to leave a comment. There is an email that will reach me in the About section here on this YouTube channel. And of course, I welcome emails from folks, whatever. Thank you guys for watching. Have a good day.